Here's the answers to your application of vet nursing care mock examination, which was sat on the 16th of December 2020. Please do remember to upload your marked papers using the led submission, as it allows us as teachers to see where your current progress and current understanding lies. It also gives us the opportunity to refine our revision approach, which we'll be doing together in January. The first section then that we're going to look at is section A, and as a reminder, this is worth 50% of your total exam mark, and therefore we would expect you to spend 50% of the total time on this particular part of the paper. Now, as with all papers, it is your choice how you manage your time, but it is always worth remembering the overall mark allocation, particularly if you're struggling or slightly worried about the use of time in the exam. So the first question you had then was, describe the dietary requirements in the nutritional management of a dog suffering from right-sided congestive heart failure. Now, hopefully you weren't thrown too much by the presence of right-sided congestive heart failure, because as we know, cardiac patients have the same nutritional demands, whether they are right-sided or left-sided heart failure. So this particular question was worth 6 marks. And in this particular question, we're looking for 6 different dietary specific requirements or dietary presentation requirements. So the first mark was awarded if you had mentioned potassium levels, and this is particularly important in patients that are having quite extensive diuretic treatment, as we know that potassium is lost as water is lost or eliminated from the body. So if you said anything about potassium supplementation or requiring the maintenance of potassium, you can have 1 mark. The next comment then is that you provide increased level of protein, and the protein that you're presenting should be high biological value. So again, if you stated anything around the presentation of high biological value, then you can give yourself a further mark. The third mark is that it needs to be highly digestible. And now the important thing is for cardiac patients is they are already under quite a significant level of pressure from their physiology, so therefore we want to make sure that whatever we give them is easily digestible, and that the metabolism process doesn't have extra effort in order to get the nutrients that this animal needs. So if you said highly digestible, that's your 3rd mark. Your 4th mark comes from recognizing that it needs to be palatable. Now, a lot of our cardiac patients, because they are feeling so wretched, often demonstrate signs of anorexia, so therefore again it needs to be something that's highly palatable, something that's particularly tasty, that's going to encourage appetite in our cardiac patients. So if you said palatable, that's your 4th mark. As we know, cardiac patients have a high energy demand because of the presence of cachexia, so your 5th mark comes from identifying the need for increased energy provision, specifically from fats and carbohydrates. And then the last comment is low sodium. And the reason why we want to have low sodium is if there is a high level of sodium in circulation, it encourages the retention of water. So again, our patients are on diuretics. We don't want them to retain water, so therefore we want to give them low sodium. So that's your 6 marks. Question 2 then. Discuss the emergency management of a feline patient presenting with circulatory compromise to facilitate stabilisation prior to examination by the veterinary surgeon. Now this mark is worth 8 marks. Sorry, this question is worth 8 marks. And I appreciate this is quite a lengthy question, but the key thing here is we're thinking about stabilisation and your role as a veterinary nurse in ensuring that your patient condition doesn't debilitate or doesn't worsen whilst it's waiting for the veterinary surgeon. So your first thing you want to try and do, because your patient is in circulatory compromise, is to keep the animal nice and calm and to reduce any possible stress or anxiety. So if you stated that, that is your 1st mark. Your 2nd mark comes from acknowledging that you need to keep the environment stress-free and remove any stimuli that might be causing additional anxiety. So if you mentioned about turning noises down, placing the animal in a nice quiet environment, turning down lights, for example, to avoid overstimuli, limiting the number of staff that are in proximity to the animal, all of those things are suitable and would receive another mark. Your 3rd mark is awarded when you recognise the need for oxygen therapy. And in this particular patient, we would assume that we'd place them into an oxygen tent because they are a cat. Now, if you mentioned oxygen therapy and you said giving by free flow or by a mask, those are incorrect, so therefore you can have a mark. But strictly speaking, we want to place an animal of this size in an oxygen tent, as it allows for easy oxygenation and without the need for restraint. Your fourth mark comes from recognising that the animal needs to be in sternal recumbency, and it says if possible because obviously we don't want to cause additional stress for the animal by forcing it into a position that it's not comfortable with, but sternal recumbency is seen as the most suitable for efficient respiration. So if you said sternal recumbency, then that is your fourth mark. Your fifth mark comes from recognising that you need to avoid handling as much as possible. Your sixth mark comes from recognising that you need to monitor and record the vital signs of this patient. So in our vital signs, we're thinking temperature, pulse and respiration. And because our patient is in circulatory compromise, our biggest area of interest in these patients will be respiratory and cardiac function. We're unlikely to place a rectal thermometer because we don't want to cause additional stress to our patient. But if you'd mentioned extremity temperatures, for example, that is completely valid. And actually it's quite an easy, non-invasive way that we can measure temperature. Your seventh mark then comes from discussion around IV catheterization. So we generally want to have an IV catheter in our circulatory compromised patients, but depending on the overall demeanour or health of the patient, it's always recommended to delay it if it's going to cause additional stress or stimuli to our patient. And then our last mark comes from recognition of advanced monitoring aids. So if you'd said that you would place an ECG on the patient, that you would take a blood pressure, potentially if you can, depending on how kind of comatose our patient is, you might want to consider putting a pulse ox on, for example, then that would be your eighth mark. So question 3 then, discuss the use of isolation nursing protocols in the management of a puppy suffering from parvovirus, and this particular question was worth 12 marks. Now, as you can probably appreciate, there are lots of possible answers available for this particular question. So you will see from the answers that there are more than 12 answers available. Just counted to make sure there actually are 12. But we would, in this situation, actually consider other reasonable arguments. So if you have something that is not on this list, please don't assume that it's incorrect. As I say, we are quite happy at level 5 to consider justified answers as well. So first one, we have a highly infectious patient, so we want to make sure that we have appropriate cleaning and disinfection protocols in place and identify areas of high and low risk. We want to make sure that we've got appropriate ventilation in the kennel room or in the isolation ward. PPE is an absolute must. We want to make sure that we do not carry any additional viruses with us, both for the puppy because they will be immunocompromised because they haven't yet had their vaccinations, but also parvovirus is airborne and therefore there is a risk to other inpatients in the hospital. You might have liked to talk about the use of colour coding, so having segregated equipment. So in this case, it's food and water bowls, having specific food and water bowls, or having specific cleaning equipment that should be based entirely in the isolation facility. You may have discussed incontinence pads as a way of collecting waste and easy disposal of waste. You may have recommended disposable bedding because these puppies unfortunately are going to have quite prolific diarrhea, so we don't want to keep placing them with things that we need to wash because obviously we're going to keep transmitting or possibly moving our contaminated bedding around, so disposable bedding would be an option. You could have also said that you're going to segregate the bedding using a washable plastic bag, and that would also be acceptable. You may have discussed a foot bath use or the effective use of hand hygiene. You also want to talk about having adequately trained staff, but equally you could have said that you would have a separate nurse to isolate the patient with. You may have talked about reverse barrier nursing, where you have the same member of staff to avoid the risk of infection or contamination of other possible infectious diseases. You may have said something around the fact that actually any patient that has vomiting or diarrhea is automatically placed into isolation, because the key thing here is this patient has got parvovirus, but obviously you could have a suspected case, and you would want to take the same barrier approach to them. And finally, the importance of having a daily isolation risk assessment. So making sure that you regularly revisit your patient and ensure that that the risk assessment and the procedures in place are actually appropriate for the level of disease status that you're witnessing. Okay, so question 4. So question 4 was quite a long question. So with reference to clinical signs, consider the nursing advice you would give to an owner of a cat with chronic kidney disease to support home management. Now, again, this was quite a ranging question, and it does require you to have some understanding of the clinical signs associated with chronic kidney disease. So this is why it's important that you do spend some time revising your non-infectious diseases in order to have a number of different aspects that you could put into this question. So this particular question is worth 8 marks. And as you'll see from the options, we have a huge variety of different things that you could discuss. So initially, we could talk about the fact that our patient is going to have quite significant dehydration. So you may want to discuss the importance of providing suitable water to make sure that it's provided at all time. But you also may well consider the need for fluid therapy, or at the very least, the patient coming in for subcutaneous fluid therapy. You could have included some information from your pharmacology, and in this case, talking about ACE inhibitors as a way of helping to delay the progression of the disease. You could have talked about using propranolol, for example, to provide suitable reduction of blood pressure, which we know is a big problem in our kidney patients, or a possible problem in our kidney patients. You may have wanted to talk about other kind of treatment options as well. So whilst this is talking about the nursing advice you would give, and we're supporting home management, potentially if our patients are developing quite significant signs of kidney disease, you may would have talked about other options. So if you've mentioned peritoneal dialysis, for example, or surgery or dialysis, then those are other things that you could be awarded marks for. And then I suspect a long part of it then would be the ongoing management. So making sure that you maintain hydration, for example, thinking about techniques to get the cat to drink, or as I said before, discussing the need for ongoing fluid therapy. These would all be seen as suitable arguments. And then probably the biggest area is your suitable dietary recommendations. So you can potentially get a mark awarded for each of these. So if you said that you want to make sure you provide water at all times, that you provide protein and energy to make sure that your patient doesn't have cachexia or catabolism, and you want to maintain body weight. If again you've come back and talked about high biological protein, and specifically talking around the signs of urea, excess urea, so uremia is also appropriate. If you've talked about phosphorus or the reduction of phosphorus, then you can have a mark. If you talked about reducing sodium, making sure you supplement potassium, if you've talked about vitamin Bs or erythropoietin, these are all things that would award individual marks. Within your medication, you could have talked about how you're going to encourage your owner to administer the medication to make sure that the cat is continuing to eat. Any of these things would be relevant. And again, this is another question where there are quite a few different answers possible. So you would have the caveat of any other suitable marks would be considered. Okay, so the next question then is question 5, which is, with reference to recognised monitoring approaches, propose the ongoing management of nutrition in a high dependency feline patient. So within this question, what we're looking for is you're thinking specifically about monitoring of nutrition rather than provision of nutrition. So just bear that in mind with your answer. So this particular question is worth 10 marks. And again, as you can see, you have a wide range of possible things you could assess. So we've got things like body condition score, muscle condition score. If you said anything about daily weighing, or the monitoring of high hydration status, that would also be a suitable mark. If you've talked about actually just keeping a kind of a record of weight as well, not so daily weights, but kind of patterns in weight changes, that would also be considered a suitable answer. If you talked about lean body mass assessment or potentially measuring the animal to assess the lean body mass, that would also be suitable. If you talked about hair or coat quality or skin quality, then that would also be a reasonable answer. In our surgical patients, things like assessment of healing rates or dehiscence can also be a sign of malnutrition, so that would also be considered appropriate. If you talked about doing metabolic monitoring through blood tests, specifically looking at albumin levels or protein levels, that would also be considered appropriate. And what we're considering here is our hyperalbuminemia, so low albumin levels. As we said before, albumin is an essential plasma protein, but unfortunately if our patient isn't receiving the level of protein that they require, then it would also be considered quite a significant concern. With our lymphopenia as well, so if they've got a lack of white blood cells, or if they're showing any coagulopathies or clotting concerns. So you've got a number of different examples there. Again, with this question, there is a level of interpretation. So again, if you've talked about making sure that you monitor inputs and outputs, how much the animal's eating, what kind of food they're eating, the presence of food aversions, for example, would all be suitable. So kind of count them up, you're aiming for 10 marks on this question, so it would be a combination of the possible answers that we have discussed. Okay, and then the last question for section A is, with reference to recognised clinical signs, discuss clinical observations in the evaluation of perfusion status during the triage of a canine emergency patient. So this question was worth 6 marks. And if you remember your triage process, this would be our C of the ABC process. So we've already checked that our patient has a patent airway. We've also assessed their breathing status. So what we're thinking here is about the circulation, because remember, perfusion is to do with how much circulation or how much fluid is in circulation and how well the patient is oxygenated. So options you have available: if you mentioned mentation or consciousness or assessment of consciousness, then that's worth 1 mark. If you discussed that you're going to look at mucous membrane colour, and if you specified anything to do with mucous membrane colour, then that would be your 2nd mark. If you talked about capillary refill time or speed of capillary refill time, then that would demonstrate, again, level of circulation, so that would be a suitable discussion point, so that would be a 3rd mark. If you said that you're going to listen to the heart rate and specifically looking for the presence of possible compensatory mechanisms, so increased heart rate, for example, or fluttering of heart rate, then that again could suggest that there is a concern around perfusion, so that would also be a suitable answer. If you talked about pulse quality, so checking the differences between pulses, a kind of feeling for the strength of pulse, the speed of pulse, all of those things would also be appropriate. And then our last mark is the extremity temperature. So in these particular patients, whilst TPR is important, the core temperature isn't actually going to show us anything about perfusion. It's just going to show that our patient has what the patient's core temperature is. So in this particular question, we're looking for extremity temperature. You need to be specific in that, because as we know, if a patient is shocky or if they are experiencing poor perfusion, then we find that our patient goes into peripheral shutdown, meaning that circulation to our peripheral veins is reduced, and as a result we find that the circulating blood, which normally allows for an increase in temperature, is also reduced. So therefore you find you get a significant deficit or difference between the core and extremity temperature. So those are your answers for question 6. So hopefully you've got a number out of those. Okay, so that's section A, all done. If you do have any questions, please do email me directly. And just as a reminder, we will be running revision classes on the 6th of January. As previously advised, these are face-to-face, so do take every effort to actually come in on that day, particularly because revision is generally much better received if you're face-to-face, because we can do tasks and we can kind of generally chat with each other. So please do prioritise that. And as I say, any questions, then email me directly.